Anyone with diabetes knows it's important to manage insulin levels. Functional medicine offers unique tools to manage insulin and even blood sugar, including diet, exercise, stress management, detoxification, and maximizing essential nutrients. To understand how these all apply, it's helpful to know how insulin works. Insulin helps keep glucose levels in the bloodstream within a normal range. When you eat carbohydrates, they're broken down into glucose, which is our primary energy source. When glucose enters the bloodstream, the pancreas responds by producing insulin, which enables glucose to enter the body's tissues. Excess glucose is stored in the liver, and when you need it to sustain blood sugar levels in between meals, the liver releases sugar and the pancreas responds with more insulin to help it enter the cells. This balancing act helps keep blood sugar levels stable. When the pancreas secretes little or no insulin, which is common in type 1 diabetes, which is an autoimmune disease, your body doesn't produce enough insulin. Or when your cells are resistant to insulin, which is called insulin resistance, and is very common in type 2 diabetes, sugar levels in the bloodstream can get too high. Chronic high blood sugar can lead to complications such as blindness, nerve damage, and kidney damage. What you eat affects your blood sugar and your insulin levels. Not eating regularly and eating larger meals causes drops and spikes in blood sugar and insulin, driving insulin resistance. If blood sugar is a problem, better to eat smaller, more frequent meals to keep your blood sugar and insulin levels stable. Processed and fast foods drive inflammation, which causes insulin resistance and other disease processes. It also increases cortisol levels, which can increase blood sugar levels. Food sensitivities cause insulin and inflammatory responses, which can cause insulin resistance. Many people have food sensitivities they don't even know about. Pay attention to glycemic index and glycemic load. Glycemic index measures the insulin response your body has after eating a food. The higher the number, the more insulin your pancreas needs to secrete. Glycemic load is the amount of that food eaten and makes more sense to monitor. Fat cells have insulin receptors. Exercise burns calories and fat. Fewer cells means less need for insulin, and when you exercise, your muscles need more energy to fire and insulin receptor sites become more receptive. Even a short walk can reduce blood sugar levels and insulin demands dramatically. Did you know up to 90% of doctor visits are related to chronic stress? Stress has a big impact on insulin by decreasing insulin receptor sensitivity, elevating cortisol, and causing the liver to raise blood sugar, the body's way of increasing energy to handle stressful situations. Raised blood sugar means more insulin. Toxins are found throughout our environment, in body products, food, air, and water. The body gets overworked trying to deal with them, causing inflammation and increasing insulin resistance. Inflammation shuts down receptor sites, requiring the body to make more insulin. As a functional medicine healthcare provider, I understand that you have unique needs and am prepared to help you develop a customized action plan to manage your blood sugar and insulin levels, or even better yet, work on getting rid of type 2 diabetes. Thanks for tuning in. I hope you learned something about your health. If you want to know more, please go to my site, drcelaya.com. You'll find a lot more information, and you can even schedule for a free 15-minute consultation or schedule to become a new patient. If you like this video, please hit the subscribe button.